Brooklyn Independent Television.
Living with HIV/AIDS isn't easy, as you can imagine. But a disease like this affects everything in a patient's life, not least of which is the impact on his or her family. But help is available, just around the corner, in fact, through Brooklyn Hospital's PATH program. HealthBeat's Fred Brown paid a visit.
Meet Karen Thompson. She's a licensed social worker and the director of the PATH Family Program at Brooklyn Hospital Center, which caters to HIV-positive patients and their families.
By no stretch of anyone's imagination is it just medical. The issues that a family would come into the PATH Center with are far beyond medical. Medical is primary because we want to make sure people are as healthy as they can be with the virus, but we work with moms on school issues for their children, day camp for the summer, activities for the holiday season. We have
mental health included?
Mental health is key. You know that same African proverb, it takes a village. It takes a village. It's going to take all of us. Just because one person knows their status, if they're remaining in a place of secrecy, a place where disclosure can't happen, then it still impacts the community. It impacts the family. It impacts the pandemic that's happening now. So we have to get past the place of secrecy, past the place of this is just her issue and not everyone's issue.
One patient is this woman, who for this interview wanted to be called Roxy. She's 36 years old, a mother of 2 children, and has AIDS.
It's just a feeling you get when you walk through the door. When you walk through the door, you have the receptionist greets you. Everybody greets you like they already know you. You know, but it's the way they talk to you. Because most of the time when you go someplace and you tell somebody, hi, I'm here for an appointment, and they're like, what are you here for? Well, I'm here because I have HIV and I'd like to see a doctor. It's like, you know, that wall comes up and you see the attitude. But at the PATH Center, it's like, it's perfect, you know, because everybody here is for the same thing, and all the nurses and all the doctors treat you like you're their friend.
Good, good, awesome. Just came to check in, make sure everything is okay. All right, good, all right.
What goes on in
a
here?
regular clinic. Well, this is our family waiting room. This is our pediatric waiting room.
That's the rules.
That's the rules. And because, as I explained earlier, some children may know their diagnosis, others may not. So we want it to be a neutral area medical clinic. There's nothing that would indicate that anyone would be HIV positive here in the clinic, so that we help parents protect their confidentiality and continue to work with them.
My daughter is 12. I realized that when I realized there was a family program here that I can bring my daughter to and she can see the doctor at the same time I'm seeing the doctor, I felt, okay, let me bring her here. And one thing I like about that program is they do have confidentiality. There's no one there saying, oh, wow, you know, your mom has the virus. How do you feel about that? So I think that's good.
Dr. Leonard Berkowitz has been named by New York Magazine as one of the best doctors in the city for the past 12 years. He's worked as medical director for the PATH program since 2006.
A path to better health overall, and medical, physical, and emotional, spiritual health for our patients. We like, for when people hear our name, that to recognize and associate it with a high quality of care. We have social work, case management, a nutritionist, adherence counselors by the pharmacy, a psychiatrist, drug addiction counseling. All these things are available for people who need to get their care right on site. Now, the medications available now to treat people with HIV are extremely effective if they're prescribed properly and they're taken properly. And that's our goal, to make sure every single patient who needs care is getting the right medicines that keeps their disease completely under control.
PATH is one of the few facilities that provides rapid testing procedures, meaning that a patient can be in and out of the clinic with results in about a half an hour.
It was a horrible, horrible situation. People didn't want to get tested. It just meant finding out something bad, and there wasn't much to do for them. But since the modern era of antiviral therapy, which really began in about 1995, things have turned around completely, where the death rates are dramatically decreased.
I've seen people get tested And, you know, I'll tell them, listen, even if it comes up that you're positive, you have to remember one thing. You have the virus. Virus does not have you. And that's one thing I feel about this clinic. That's how they treat you. They treat you like you're the one in control.
Medical is the primary reason why someone would come through the door here at the PATH Center. But once they're here and they get to become a patient, it's anything else that's going on in their life that we are committed to dealing with and trying to resolve for the patients.
For HealthBeat Brooklyn, I'm Fred Brown.
Brooklyn Independent Television on the BCAT TV network.